Hello everyone and welcome to Smart Marketing, time to address price transparency, our topic for the April 2014 edition. I'm Art Sturm, I'm your anchor for the program, along with my co-anchor Frank Tiedemann, President of Salient Strategy for Healthcare. Frank, welcome, good to hear from you again.
Always great to be with you, Art.
Thanks. Well, I think we have a very timely topic for our audience today. We really want to start to address the issue of price transparency, and we're going to look at it in two ways, two parts rather. First is let's take a look at why you need to act now, some new research that Frank's come across that we think is pretty compelling. And then in our next session, which will be out shortly, we'll identify some options for you. But Frank, what's the basis for our comments today?
Well, Art, a very important report was just issued a couple weeks ago by these two nonprofit organizations, the Catalyst for Payment Reform and the Healthcare Initiatives Improvement Institute. It's their second effort to look at what's going on with price transparency in every state in the United States.
Well, let's take a look at what they have to say. I guess the first question is there really demonstrable consumer demand for price information?
Well, we've suspected there is for years, and their findings show that 64% of consumers have trouble finding cost comparison information. It also shows that 79% of the population would like a website that compares total cost of medical services. And the big payoff, 67% say price comparisons would affect their decisions on where to seek care.
These are pretty dramatic numbers, Frank. What you expected, or did you think we were not quite there yet?
I really thought that this was dramatic. This is like a pivot point. But for so many years as a CEO, I've faced very small demand from the public for detailed information before they would be admitted. Yes, there would be some, but we're talking about being able to count it on both hands, not this kind of level of interest. So I think things are really changing.
Yeah, I mean these are pretty compelling numbers. So as marketers, we always like to break things down into smaller units. I guess your research found out that there's some consumer segments that say they want price transparency. What do those look like?
They're really pretty understandable. First are those people who have high deductible health plans. Then there are those who have health plans that actually promote cost-conscious healthcare providers, and those people who are shopping for elective or non-emergency procedures or non-emergency surgery. And also the traditional segment that you and I grew up with, those seeking maternity care or screenings. And finally, those folks under 44, the younger folks are expecting to be able to find out price.
So really, if you translate this, it looks like those initiatives by payers to use higher deductibles as a driver for consumerism seems to be having an impact. Would you agree with that?
Absolutely. I think it's taken time, probably way too much time, but it does seem to have seeped into the culture around healthcare.
Yeah. So there is some growing consumer price sensitivity, the report said. What does that look like?
Well, the report says that the employers and these new healthcare insurance exchanges or marketplaces have really made an impact by shifting costs to the covered. And they do it, of course, through traditional means like higher copays and greater out-of-pocket expense to the consumers. There's this sense that they've measured that healthcare costs are out of control in the traditional way we've delivered care.
So all this adds up to some of the numbers that we saw earlier. It's just sort of a sum of the arguments, right?
I think so, and there's more and more public attention. As the last item shows, the media and politicians are giving this issue more and more attention, and so eventually it does get the attention of the general public.
Right. So according to the report, Frank, what sort of price information and features do consumers want?
Well, this was really interesting to me because there's some very specific feedback. People want to know the cost of the entire episode of care, not just pieces and parts. They want to know the total cost that they will incur. They want to know the cost of shoppable, standard, or elective services like screenings and immunizations. They want this to be provided to them in simplified ways using symbols or estimated dollar amounts to simplify choosing high-value providers. And this example below of the Zagat ratings of restaurants is just one way that the public has been taught to look at a complex choice. In this case, picking a restaurant is easier than picking a hospital.
Yeah, I think that's really important. We're going to talk a little bit more about this, but let's just take a look at the second point about the cost of shoppable, standard, or elective services. It was interesting that was carved out as very precise things that they were looking for in contrast to more complex procedures. Did that jump out at you?
Yeah, it did, although I think this is something that people more frequently purchase rather than care for a heart attack or cancer care. So they expect that it would be simpler to find out what it would take to get a diabetic screening or some other form of immunization. They expect that they could get a price without, having to work really hard at it.
Yeah, I agree. So let's look at some of the features that they're looking for.
Yeah, this was really specific and interesting to me that they expect to see things like the use of dollar sign graphics to indicate the least cost-effective providers and facilities. So the more dollar signs, the less cost-effective. Or cost information paired with clear, simple quality information so that they can figure out if it's high cost, is it also high quality? And use of terms, simple terms like below average cost or above average cost and quality. This makes sense because these are the kind of terms that they see in many other retail settings. Don't you think?
Oh, absolutely. I mean, when I saw this page, it said, we've trained the American consumer to shop by symbols, and it looks like they're just applying that experience to the healthcare world. Contrast that with what CMS has now come out with their new report. This is the physician report that they just released earlier in March, and as you can see, the data goes way off the right side of the screen and gets into levels of detail that only CMS could do. If you are an expert in CPT coding or ICD-9s, you'll have a field day. But if you're just an average guy or woman, it's probably going to be as useful as the hospital data they put out a while ago, right?
Absolutely. In fact, it was fascinating to me. In their press release, one of their spokesmen said, we just haven't figured out how to make this stuff understood by the consumer. And they proved it with this report. It's thousands of items of data, and even well-trained hospital people would have trouble navigating it. It's so large and so diffuse.
Yeah.
But this is theoretically you're supposed to be able to look up your doctor and find out questions about the cost that he generates or she generates.
Yeah.
I just don't see anybody doing that.
I'm sure there are some who will, but for those who are looking for 3 stars or dollar signs, this may fall a little short. So what about what's the report card on state pricing transparency laws? There we go. What did they say about that?
Yeah, it's a tongue twister, but that's the official name of the report by these two nonprofit organizations. And their charge, which they gave to themselves, was to look at what's going on in every state, what the state laws allow and demand of hospitals and doctors in terms of release of data, and then really kind of to evaluate the good, the bad, the ugly of what's out there for consumers. So the first thing they looked at is what are the sources of price information that the states mandate. And most of them mandate provider information only, meaning sticker price. Some, a very few, have all payer claims databases. We'll talk more about that because this is a big emerging area. They also looked at how price is disclosed to consumers. Is it upon request only? Is it a state report, generally a bound report of some kind? Or is it on a website that consumers can go to at their leisure? They also looked at what are the elements of price information that are available. Is it just hospital charges, or is it the amount the insurance company paid, which is really the relevant thing for most consumers? Not the sticker price on the side of the car, but what you ended up paying to get the car off the lot. They looked at provider information. Some states only have hospital facility information, others have physician information only, and some are state hospital associations, so you have a little bit of both and not always comprehensively both. They did come down on the side of what they felt the best approaches were, Art, and I think this is worth some real thought, because this doesn't exist in any of the 50 states. This is like best of show, pulled from every element that they investigated.
Well, let's take a look.
First, they said everybody should have access to all payer claims databases. That means you could tell what the doctor was paid, what every doctor involved in the surgery was paid, what the hospital was paid, and any other related things like lab tests and imaging. So you could know exactly what the entire episode of care is. That's really pretty radical, because it's just not there in most places. Yeah. They said this should be available on a website, so you don't have to have permission. You can go and get this information. They said it should obviously be the amount paid, not the sticker price. That's really driven by this all-payer claims database. And of course that both facility and physician providers should be included. So this is their view of Nirvana. They think it should be run by the states, not by private organizations like hospital associations or business groups on health, because they think that would guarantee that the data would be clean, would be permanent, and it would never go away.
Did the report give any indication of the degree of difficulty of doing this? Is this something they think can be done easily, or how high is the bar for this?
Well, some states would have to come further because they have very little and they're not spending any money at all on it. But in fact, this is the kind of thing that state law could change and mandate very quickly. I'm sure that they would give the insurers several years lead time, 2 or 3 years lead time to build these all-payer claims clearinghouse kind of information, and that would instantly provide the data. And mandating that physicians' data would be released is politically somewhat controversial in some quarters, but I think the tide of interest is so strong that it would be very hard to stand against it. So I think the report says, we ought to do this, and we should do it now, not later, because we're asking more and more people to take greater responsibility for the cost of their care.
Yeah. Well, before or beyond the state law, what are we talking about here?
Well, I think the question is, while the 50 states think about what to do, there are things that hospitals could do right now to present their pricing more accurately to the public. And it doesn't mean, excuse me, it doesn't mean just posting your hospital charge master online. That's not enough. That's as bad as this big Medicare data release. It doesn't mean offering a 1-800 number that consumers could call up and say, how much will this cost? Because right now the answer is always, it depends. That's the hospital standard answer.
Right.
So we think publishing a booklet, which of course is obsolete 10 minutes after it's off the press, is not enough either. And finally, trying to command physicians to voluntarily disclose their fees is just not going to work. So this is something that hospitals need to sit down with their medical staffs and their board and with business and consumer groups and discuss what makes sense in their community. I think that many large facilities are trying to release data in order to get in front of this issue, and they may do it much more quickly than a state law will change things. The real issue, as we see from the earlier slides, is how are you making this information useful and accessible to the public? And that, I think, does require some discussion and some willingness to move outside the comfort zone of publishing a huge spreadsheet of gibberish.
Yeah. Well, Frank, I think you've made a great case that the demand for this is today, that it's not a distant requirement or request from the marketplace. They're really looking for it now. And I think what's even more important for our audience is to understand the level of simplicity that the marketplace is asking for. Dollar signs, stars, ratings, and again, adapting the behavior that they're familiar with and just applying it to a different industry. So on the one hand, it's a little sooner than maybe that people thought, but on the other, why wouldn't they think this way?
Yeah, I think that's the real challenge here.
Yeah.
So do you wait until you're the last hospital meeting a reluctantly new law, or do you grab this and use it as an opportunity to show your willingness to work with the public and help them make better informed decisions? I think progressive organizations are grabbing hold of this issue.
Well, that's going to be our topic for next time. Art and Frank are going to discuss how hospitals can encourage and benefit from price transparency, and we'll have that session out to you in the next few weeks. Frank, I think we got our work cut out for us coming up with some thoughtful ideas there, eh?
Oh yeah, we've got tons of things to suggest.
Yeah. Hey, we really appreciate everyone joining us today for this look at price transparency. Frank and I are always interested in hearing from you. Here's our contact information. I'm Art Sturm. Frank, glad you were with us.
Thanks, Art.
Thanks to our audience. We'll talk to you next time.